Okay, first we'll throw a question open to our attendance here in person. Jeff, sorry, the administrator would like to say.
I think Ms. Bryan and Dr. Meyerson had pre-information.
Oh, okay.
They wanted to place out there before
All right.
Questions.
All right, who would like to go first?
I'll be glad to go first. This is Denise, Bryan. I want to thank Commissioner Wallace for the warm welcome first, and Jeff Lawson, all the commissioners. It's a pleasure to be partnering with you to serve our community. I think it is important to have the opportunity to talk about multifaceted aspects of this pandemic. A year ago, all parts of our lives were impacted, and it is a novel pandemic response, and there are a variety of views, and there's merging of information all the time. District Health Department number 4 is your local public health, so our employees live, work, play, and pray within the communities, and we're your neighbors. I think we have had an exceptional response to serving the residents and keeping our commissioners, who are stakeholders who make decisions, informed. On this call is Jen Curl, our nursing director, also our epidemiologist, Devin Spivey, Joshua Meyerson, who is our medical director, and there's a whole team of leadership and staff that have worked endless hours and made personal sacrifices to keep our residents informed and also to embrace best practice to mitigate transmission and ultimately death in our community. And the total deaths for District Health Department 4 is at 125, and Cheboygan has recorded 37 deaths. And I think ultimately that the measuring stick that I talked to the commissioners a year ago, that the virus is invisible, very true. It's a virus that will mutate. And what we learn about it changes, if not weekly, daily information changes. We do have a very informed constituency, and the process of sharing information, I have to give a shout out to Kathy, our PIO. She has kept our Facebook, social media, as well as our dashboard at dhd4.org. If anybody wants to follow the data we have there. We were utilizing isolation and quarantine and information sharing as our main mitigation factors. Eventually, masking, 6 feet distancing were embraced as well. Epi tracing is important in that if we can prevent the spread. The difficult part is the 14 days quarantine that the virus was identified to have an infectious period. Over time, it's been allowed to be reduced down to 10 days if there's asymptomatic presentation. And there is a variety of staff that are trained in EPI, both at the state level and local, to keep people who learn that they're positive informed of what the test result means and the best practice to prevent spread. There really is many different opinions with the decisions out of Lansing, whether it's from the governor or the state health department. I will say with the vaccine being developed, approved, and released, it did create more of a offensive for us, and I think a little more hope that we could get back to our new normal. The state guidelines is to get 70% of communities vaccinated. There no doubt will be vaccine hesitancy or informed decisions not to get it based on their personal reasons, whether it's medical or belief. And this will be no different than any other vaccine. I think that running the vaccine clinics, as the commissioners pointed out, it takes the whole village to have an efficient and effective response. Sergeant Holt has been instrumental in coordination in the Cheboygan County, and as well as the county staff, the volunteers, and the National Guard that I'm sure exhaustively have covered the state of Michigan to work vaccine clinics. Also, the Knights of Columbus has a lease, so we have utilized space during the winter to put large volumes through. And due to the flow of analysis and the teamwork and really the experience that so many people come back and work the clinics, we have put 1,000 people through the vaccine clinics, and we could probably go to 1,500. And of course, with better weather, we could be at the fairgrounds and easily doing 1,500 or more. The question really comes in, is there enough vaccine access points for a variety of people in the community where they can get their vaccine? And Dr. Meyerson will tell you that if you have an opportunity, whether it's Moderna, Pfizer, or Johnson & Johnson, he recommends all of them when you're able to get a vaccine. That I think all of us, and especially the mental health piece of being through a pandemic and the trauma and the impact to our lives, we all want to move back to that new normal. I think the mutating virus and the variant needs to be closely monitored. It does appear more infectious, but we're not seeing increased hospitalizations, which is severity of illness or death at this time with the UK variant or the South African. The response to the vaccine, Dr. Meyerson can probably address that. We're all hopeful that as the virus mutates, we will have the antibodies to prevent ongoing transmission. I do think the Easter gathering and travel does increase our risk. In terms of our cases, we have 11% positivity rate, which has gone up for January, February, and March. Most of our cases we're seeing spread through sports and social gathering, but at this time there is probably community-wide spread. The vaccine, what we're doing today with our clinic is allowing for, we've been pre-registering people so that we can really account for the vaccine and be efficient with the time there. Being that we had over, I think, 150 vaccine doses that we didn't have people that were scheduled for, we opened up yesterday that vaccine to our tourism industry, restaurants, bars, and retail to look to offer to get them vaccinated. One of the seasonalities of Cheboygan County is that we're going to have a surge of visitors to our area within weeks. And we would like to use the Johnson & Johnson, the one dose for some of the seasonal workers, and also look at getting our tourism industry, those who want to get vaccinated sooner than later. So those are some decisions we make locally. We stay connected with MDHHS in the governor's office, who have been leading the epidemic orders and the recommendations, and Dr. Meyerson does stay connected with the latest scientific data and connected with other medical directors around the state. I think we're all ready to move closer to that new normal. And I just think it's a balancing act of utilizing best practice and protecting our vulnerable populations, as well as looking at that science and about the herd immunity, whether it's naturally acquired like the chicken poxes, and then if a vaccine is out there, making sure that people get all their questions answered so they can make informed decisions on that. So there definitely has a lot multifaceted things happening with the pandemic. I think there's a lot more we should be proud of, but the struggle is real with the changing information and really a difference of opinion. And Dr. Meyerson and I always say we operate from the public health lane, and we're here today to turn the floor over to further questions or inquiries that we can best address or get the information back to you if we're not able to answer today. So thank you for your time, and we look forward to your questions. Dr. Meyerson, did you want to add?
Sure. Yes, thank you. My name is Dr. Josh Meyerson, and thank you for having me. Thank you for hosting this today. I think it's important that, and I'm happy that I can be available to answer any questions. Just to add to what Denise said is our cases are up. We had the big surge in the fall and into January, and then February we had a nice slowdown, and truthfully I was feeling pretty good. We weren't having very many cases, but our case count in March has continued to climb upwards, and it's feeling a whole lot more like November already, and that concerns me. The variants are here. I can tell you it was identified Gaylord and Otsego County, for those who follow the news, has had a lot of cases, as well as a lot of our area schools throughout northern Michigan, and we have found the British variant there. I think it is safe to assume that it is here. It is in northern Michigan, and it's doing what we thought it would do. It is not thought to be more serious as far as disease, but it's more transmissible. So we're seeing, instead of seeing 2 cases become 4 cases, become 6 cases, we're seeing 2 become 4, become 8, become 16, and all of a sudden our case counts are going up quite a bit. And that was what was predicted and what we felt was going to happen. And certainly we didn't want it to happen, but here we are. So I think it just reminds us that the fact that the variant is here doesn't change what our message to you is. The message is the same. We need to continue doing the mitigation measures that we're doing. We're not out of the woods. When you look at our curves there and the big surge that we went through that really peaked into January and February, it's come down, but now we're climbing back up again. And that tells you that we don't have community immunity. We don't have herd immunity. And it's great that we've vaccinated. We've given over 16,000 doses, and it's important to protect our most vulnerable, but it's also important for as many of us as possible to get vaccinated, because really to get to that herd immunity or community immunity, we need a large percentage, the vast majority of us need to be immune. And we can do that 2 ways. We all want, no matter what your opinions are, we all want, I call it community immunity, herd immunity. We all want that, right? We all want to be in a place where so many of us are immune that the virus has nowhere to go. It can't bounce from one person to another, and it just keeps hitting dead ends. And then it won't go away completely, but we won't have big surges or big increases. We'll have a low level of transmission. We'll have sporadic outbreaks, but we really can kind of get back to our lives. And all of us want that. We're all in this together. And to me, vaccination and immunization really is the way to get there, because that's going to save lives. It already is showing it's saving lives. It's saving lives in countries and in areas where they have higher immunization rates. They're seeing lower hospitalizations. They're seeing lower deaths. I would much rather that our community and my friends, my family, my neighbors, I would much rather that we get to that level of immunity through vaccination than through the suffering and the deaths that would have to happen if we didn't have these vaccines. So I am really excited. I think it is an amazing thing that we were able to do that. We have 3 very safe vaccines, 3 very effective vaccines. And as we get more and more access points, we can really speed this up. And as Denise said, our prioritization groups are expanding greatly. Pretty much anyone with any adult with a medical condition or in that frontline essential workers can get vaccinated now, and soon it will be open to everyone. And I encourage everyone I know to get vaccinated as soon as they're able to. The other thing, just to let you know, it's not all doom and gloom, but with these increase in cases, what often happens is cases go up, we start seeing more hospitalizations. And I got an email I just got notified from the hospital in Petoskey that there's in 5 days, their census, the number of people in the hospital with COVID doubled in 5 days. They had to open up another respiratory unit. They can handle it, they're doing fine, and they've come a long way at learning how to treat this disease. So it has become less deadly as our doctors have learned how to treat it better. But it still is, can be deadly. And as Denise said, 37 people in Cheboygan have lost their lives. We've had 15,000 deaths in Michigan and over 500,000 deaths in the US already. It's not just the flu, it is more serious. And I really do think we can see the light here, but I just encourage everyone to get immunized as soon as you can, because it really is going to be our way to get back to a place where we can all be comfortable living our lives. So with that, I will stop talking, and I'm here to answer any questions.
Thank you, Doctor and Denise. Let's throw it open to, we have an audience here in the boardroom, so we'll do that first, and then we'll do the public out.
Oh, got it.
So you're fine.
Oh, okay.
Introduce yourself, please.
Hi, I'm Beth Bridgman. I just wanted to clarify on the numbers. If you can tell us the number of people who died in Cheboygan over the last year that weren't COVID related, and the number of people in the state of Michigan who died of other that wasn't.
Did you hear that, Denise or Doctor?
I didn't hear the last part of the question. I'm sorry.
I'm wondering if you have the numbers for people who died in Cheboygan County over the last year that were non-COVID related, and the number of people who died in the state over the last year from non-COVID related issues. Thank you. Yeah,
I think that's a good, I don't have that data in front of me right now. Certainly lots of people, people die every year. So yes, there have been lots of non-COVID related deaths. But for those, when you look at the number of deaths in Michigan from COVID, those are real. And if you look at the excess number of deaths, the year 2020 was the deadliest year on record. The number of deaths versus what would be predicted and what we've seen in the last years, when you look at the number of deaths per year, it spiked last year. And the excess deaths from all causes, not just COVID, from all causes, the number of people that died last year was one of the deadliest years on record in this country. And those deaths are real. You can't deny that.
Okay, but if you can't provide numbers on what is the non-epidemic population, don't throw around numbers that support your epidemic. If you're into numbers, there's two sets of numbers.
Thank you. Any other questions from our audience here?
John Studer. My question is, what is the point in pushing an experimental gene therapy and calling it a vaccine when it in no way meets the definition of a vaccine? It neither stops one from contracting it or spreading it. So why are you pushing for everyone to take something that's not even a vaccine?
Thank you, John.
Thank you.
Did you hear that?
I can just reply to that and say, this is a vaccine. The vaccines that are out there, both the mRNA vaccines and the Johnson & Johnson vaccine, do not alter your genes in any way. They cannot, the way they're made. mRNA vaccines don't enter your nucleus where your genetic, your DNA is. So they don't do that. But the clinical trials were quite, when they gave this life-saving vaccine to 20,000 people in the one trial, 15,000 people in the other trial, over 40 million people that have gotten these now. The result is they didn't die from COVID. They didn't get COVID. It was 95% effective, and completely protected the group in the study group from severe disease, from having to be hospitalized. So the data to me are quite clear that these are safe and they're effective. and I recommend it to everyone I know.
Well, that's unfortunate, but the truth is it is not a vaccine. It does not stop you from getting it or transmitting it. So it is no way.
Well, I would disagree with you, sir, because the data, the science state otherwise. The vaccine is protective, and to say that it doesn't is just ignoring the published data. Thank you.
Thank you, Dr. John. Anyone else in the audience?
William Brown, Benton Township. I got a question. How many people have died from taking the vaccine? What I want to know.
Did you hear that, Doctor?
Yes, I don't know of anyone who has died from the vaccine. The allergic reactions that you heard about were in the 2 to 5 per million. So very, very rare. A severe allergic reaction is extremely rare, but the ones that did have that were treated, and I can tell you that's why we have medications. Although it's extremely, extremely rare, I wouldn't anticipate we would see that. We are prepared for that. That's why at our mass clinics, we've been fortunate to have EMS there, so that if we do have a severe reaction, we have the personnel and the medications so that we can properly attend to anybody's needs. And I really appreciate the county's support in that.
Well, I know of one that that was on the news that she was a very young lady. She had a young child. She was like in her 20s. Took the vaccine and she died. And if you're denying that, you have an issue with yourself, sir.
Anyone else in the audience?
Hi, Debbie Pond.
Hi, Deb.
I have a little bit of a technical question about numbers. Sometimes I feel like I see the numbers on the health department website, which I love. Thank you. I love seeing those numbers on there. But sometimes I feel like I look at them and compared to the state website, and they look a little different because I feel like there's a difference between the probable cases pulled in with the actual cases, and I feel like the state only has the actual cases, and then I try to compare it with the case rates, and it's a lot of numbers I try to jumble around in my head and I can't figure out, so I'm wondering if you can explain that a little bit. Thank you.
Any response?
I think the probable definition of COVID changed over time in tracking, and there was a point where there wasn't enough testing early on, so the opportunity to test wasn't there, so they would call probable cases contact to a known positive and developing symptoms consistent with COVID. Also, there was a recovery period of 30 days that was established in Michigan, where they were looking for people to count them as recovered cases, and those definitions changed as well. We do have an epidemiologist, master's in public health, Devin, that has been responsible for really the daily updates, and we even did it on the weekends last year, and we reduced down to Monday through Friday, and District 2 as well. And the state has a really nice dashboard on both vaccines and epi data, and those are some of the differences that I have seen with the definitions. And I believe everything is underreported because we don't have people going for testing like we did last year. And so I do think that it's a tip of the iceberg. We look at the metrics of hospitalization, ventilators in use, and death statistics along with other data, because I think everybody realizes, as kind of discussed here, numbers alone doesn't paint the whole picture, so you really do need to look at numbers in comparison. So that's my response. I don't know if Dr. Meyerson or Devin want to add anything additional on statistics or epidemiology tracking.
Thank you.
I I can just add the case counts. I think that's wonderful that you're following that, and you are noticing some differences, because there are going to be times where the numbers don't completely align, and that's just simply because they may be, one is catching up to the other, or they don't completely align because of slight differences. But I think you'll see the trends stay the same. The one thing with probables is with the development and the use of those rapid antigen tests, those count as probable, and that's why and so many of our cases are now appropriately being diagnosed with those in doctors' offices and schools and urgent cares and things, that we are just reporting total cases that is the sum of those confirmed and probable. And as Denise said, of course, the true number of cases is for sure higher than we know, because not everyone with COVID gets diagnosed. They may have mild disease. They don't need to go to the doctor, or don't get a test. So we know that there's many more cases out there, but as we follow it, the trends are what's important.
Thank you, Doctor.
Mr. Chairman, can we go back to Denise, Bryan, and to clarify a point? Did she say that we are testing less now than we were a year ago? I saw she said we were testing more then than we are now. Is that the case?
Did you hear that question, Denise?
Yes, there's a lot of different access points for testing at pharmacies and hospitals, and other doctors' offices may be doing it. The comment on testing, that from my perspective, was last year the local health department set up those drive-through testing venues, and hundreds came. And we did one recently at District 2, and 5 people showed up for the whole day testing event. I think the evolution of Binox, or the rapid tests that are utilized with a lot of the sports, is happening. So there's increased screening and testing. PCR testing, like that's gone up, but in terms of local public health, we haven't seen that we haven't pushed out a lot of that mass testing. Rather, we're doing the mass vaccination at this time. So that's my clarification.
Thank you. Any other question here in the audience? It's a question now. We're question time. We don't want to debate.
We can still, can I ask another one? Okay. Beth Bridgman again. Why did they block the use of HCQ in our state, hydroxychloroquine, when like 5 other countries around the world, like India, gave a 12-cent dose to every one of their citizens at the start of the pandemic last March or April? And they have had almost no problem with any epidemic or pandemic. And I believe Brazil was one of the other countries. Why did our governor block, or the health department block doctors from using this vaccine, or using this therapeutic? I'm sorry.
I can answer that. We don't block it. Doctors can, we have nothing to do with what doctors prescribe or don't prescribe. But I can say, the hydroxychloroquine, which, there was this thought that it, might have an antiviral effect and have some beneficial effect. But unfortunately, it's been studied where they've given it in clinical studies where they've looked at it, given it and compared it to people who didn't get it. And unfortunately, it does not have any beneficial effect. They didn't see any effect. So there's no recommendation to use that anymore. And I think to me, it's very obvious that it's not helpful. On the other hand, we do have many medications we have found out that can help, keep COVID disease from becoming severe in people who are newly infected. There's some of the antibody treatments that our local hospital is using that really can be life-saving. Simple medications like dexamethasone, a very inexpensive steroid, can be life-saving for people who need to be hospitalized and require oxygen, and other medical therapies that have been approved for use that you probably heard, that our past president received when he was sick with COVID. Those are there, they're available, and they have been shown to be beneficial, and those are being utilized in our area.
Thank you, Doctor. Anyone else in the audience?
Debbie Pond. I'm a strong believer in wearing masks, but I've had conversations with people who are not. And a lot of people say that they're not because they believe the messaging they see on the box that say that they're not recommended for use against safety for protection against a virus, and they compare it to the type of protection that a mask provides for, say, asbestos removal, for people that do paint removal for asbestos, and they say, well, you need these, this heavy equipment type thing, and if you need this sort of heavy equipment type thing for asbestos removal, well, that's what you need to keep you safe from a virus, so why should I bother wearing a mask? What do you say to people who believe those things?
Thank you, Dan.
Thank you.
What I say, and that's hard, is certainly masks are not 100%. That's why we have multiple layers of strategies. That's why we still talk about keeping your gatherings small, trying to limit indoor social gatherings and keeping that 6 feet of distance. But masks, what you're alluding to is, for instance, if you're a nurse or a doctor and you're taking care of someone with tuberculosis, a regular mask will not give you the protection that you need from that airborne spread from the tuberculosis bacteria. You need a better mask or a respirator or an N95 mask, and that's to protect the user. Surgical masks and the cloth masks that many of us utilize, what they will reduce the risk of me getting sick from someone else, because if they cough or sneeze or just talk and those droplets come out, a lot of them are just going to hit that mask and help protect, but it's by no means 100% because those masks don't completely seal around my mouth and nose. But just as importantly, those masks, and a main reason why we utilize them is it helps for me from giving it to you. When I wear a mask, I am saying I don't want to give you COVID because, I feel great. I don't think I'm sick, but some people can spread this before they have any symptoms or without having symptoms. And it's that asymptomatic spread, and wearing the mask is helping to protect the people around you. So that's why it's important for wearing masks. So if they may not be concerned about their own health, but I would hope they would have some concern about the people around them as well. So that's where mask use is important, and that you really need everybody to utilize it. So that's what I try and tell people.
Thank you. Any other questions?
Yeah, this is Mark Gann.
Hi, Mark.
Hear me?
Yeah.
Okay. My question is that I followed the government kind of narrative for quite a while at the very beginning, and it seemed to me that something wasn't adding up. So I started researching. I'd gone to Petoskey Hospital and spoke to a couple very long-term people that work there at the hospital, and in their private lives with their own children in school and stuff, they absolutely will not mask up their kids. They're upset about it. And so I started to look around some more and more and doing my own research. And in my mind, things keep going on the road of, well, a little bit longer, and now it's this, and now here. And it seems to be the government narrative that keeps coming out. So I've done a lot of research, such as frontlinedoctors.com. That's one source, along with hundreds of others. And even going back to the 95% success rate with the vaccine, as the doctor had stated, that if the elderly did not take HCQ or whatever else, that they had a 95% rate of success getting through it with no help or assistance. So those are some of the figures that are also out there. But there is a plethora of doctors opposing this commentary that I'm hearing here. So I'm wondering why that everybody, and there's a whole bunch that are for the HCQ, saying you don't need to do this, don't need to mask up. Immunity is a good thing. People die all the time. The rates do go up. They're not spiking, just like the birth rates keep going up every year compared to the prior year. So do the deaths. We have more population. So why is this So many other people screaming for show the pathology. This is where things really are. Don't listen to the narrative. Why is that so many other places other than a few that seem to be government orientated have their narrative and there's a whole lot opposing it? Why is that so, doctor?
You know, there's always going to be some out there, but every physician I know, all of the groups I work with here, with the hospital and the healthcare systems in northern Michigan, they're all very supportive of the mitigation measures and the recommendations that we're going out. Are there some physicians who, and some providers or some people in the healthcare field who may think differently? Of course there are, but I think the vast majority, if you poll them, are going to tell you that this is a real issue, and the mitigation measures are going to be very important to save lives in the long run. I mean, we're all tired of this. I'm tired of wearing a mask. Okay, I'm not gonna say, I was in the airport and I had flight delays and I had to wear a mask for basically 16 hours. Was I really happy when I got in my own car and I could take it off? Yeah. We're all tired of it, but I also know we're just not at the point where we can stop doing all of the things we're doing. I really do think we're getting there. I know people are tired and fatigued with having to go through this, and I recognize that. I feel that in my own self, but it's still important that we do it, because I don't want, the last thing I want to do is give someone a disease that could kill them.
Thank you, Doctor. I have a question for you, John Wallace, the chairman. Can a vaccinated person or a person that's had COVID spread that to anyone else?
That's a great question. And, the CDC would come out and say, well, we don't have data, but I think we do now. And I think, people who are fully vaccinated are much less likely to spread it to someone else. Much less likely is great. And that's why someone who's fully vaccinated doesn't have to quarantine if they're exposed, because we really feel that you're less likely to get infected and you're less likely to spread it. But much less likely isn't 100%, because the vaccine, the medication, nothing's 100%. Could you still get a mild illness or have an asymptomatic infection and still spread it? Yes, you could. I think people who are vaccinated are much less likely to spread it, but it's not zero. And so until we can get enough people protected so that our community transmission, when we see much fewer cases in the area and much less viral spread and presence in our community, then we're going to all feel a nice fresh air and feeling that sense of relief. But until that time, we still have to be vigilant. But to answer your question is if you've been vaccinated, you're much less likely to give it to other people, and that's a great thing, and it makes you feel good.
Thank you. We're still by phone or virtual. Who's out in the audience who has other questions?
Louis Balance.
Hey, Louis.
Question for the health department folks here. With the disabled population here, we are being, should I say, a little bit abused here with this mask orders that have been put down by the recent one that is on the March 19th. You have page section 7 with the gathering restrictions and with the face mask restrictions at gatherings or requirements of gatherings. Section 7 D. A person responsible for a business or store or official office or government offices, schools, organization, events, or the other operation or agents such as or of such persons may not assume that someone who enters the facility without a face mask falls within one of the exceptions specified in Section 8 of the order, including the exception for the individuals who cannot medically tolerate wearing a face mask, an individual's verbal representation that they are not wearing a mask because that they fall within a specific exception, however, may be accepted. The problem I have is that last line there. It says, however, may be accepted. That should be, however, shall be accepted, because that one word, may or shall, offers the company, such as Indian Trails bus lines that come up from downstate, to have what's called a medical documentation requirement for you to not wear a face mask, whereas Section 8B says cannot medically tolerate wearing a face mask. I have a couple of medical conditions where I cannot wear a face mask, and there's no provision in state law that says we have to have medical documentation. I mean, I think the health department and MDHHS, I would like to get a clarification on this. Is there a medical documentation law in Michigan regarding the exceptions on this orders? And if there is not, then I would like to see the health department go after these companies who are abusing the law of this order, because I haven't been able to travel since March of last year, and it's affected me physically and mentally. So we need to the disabled community in this state needs some sort of clarification on this. I know the national orders are in, even the CDC has no medical documentation requirement. So I'm asking you as the local representatives for MDHHS, is there a medical documentation requirement in the state of Michigan? And if so, I need to know what the MCL or what the order is, so I'm more informed. And the second thing is on the numbers. Instead of showing, we need we have the total numbers, but we don't have the recoveries and the actual numbers, being reported, because it makes it sound like Cheboygan County's got 1,100 cases, and that sensationalizes it. That it sounds like we are in a bad situation, and we're not. From what I am understanding, is we only have probably less than 100 cases that are actually active right now. So I need to get answers on that. I look forward to I look forward to your responses to those questions, please. Thanks.
Really, I would say locally, if required by public health or a company were to ask, we have accepted verbal and with not any details as to what the medical reason is, just like if someone had a service dog and if the inquiry was verbal, do you have a medical condition to have the service dog? If the answer is yes, that's what we accept. I will take it back to the state, as anybody else can also share their opinion or ask the state leadership. But for that Section 7, I'll highlight that back to the state on the written versus verbal. And in terms of recoveries, fortunately, the 30-day recovery date, there, and maybe Dr. Meyerson can speak to this, there's a small percentage that are long-term COVID kind of afflictions or side effects. but the vast majority of individuals are recovering from COVID. And that's why the fatality rate, mortality rate with this disease was kind of the statistic we were watching in hospitalizations with the disease or needing ventilators. But Devin, I know you're on epidemiology, and there's a lengthy discussion on tracking recoveries. And I don't know the specifics of other than the amount of disease that cases being tracked that is been more sophisticated with rapid testing, antigen antibodies.
Thank you, Denise. Any questions from out there on the phone?
Yes, this is Ashley Gann. I would like to touch back a little bit on the numbers, actually a few things. I'd like to know where you're getting your death numbers, because any website you look up on national death tolls, you know, worldwide death tolls, they are all in line from 2016 to 2000 or to 2020. 2020 was not the deadliest year, period. You know, you compare the numbers. I mean, we should be up 600,000 at least over any other year.
Excuse me for interrupting, but this is a question time, not statements. We have questions. We have questions, experts, and if you'd like to ask a question, that's fine.
I'm asking him where he's comparing his numbers. He said 2020 was the deadliest year.
Went on to make a statement.
No, I want to know where he's getting his information.
I got it from the Centers for Disease Control, and they showed just, through the first 9 months of 2020, there were 300,000 excess deaths in this country compared to what would be projected. Yes, as our birth rate and our population increases, they expect deaths to go up, and they can estimate that. But just in those 9 months, there was over 300,000 excess deaths. So that was published in the MMWRs. It's readily available. And I haven't seen, I'm sure, that's been updated, and that number is greater as they look at it. But we get our local deaths, we get those from our hospitals and our providers when there are deaths that are felt to be due to COVID. I'm not their treating physician. I trust what our physicians, our medical examiners take, and that's where we get, most of our death reports from.
Thank you, Doctor. Anyone else? Hang on. We're still outside. Anyone else? Virtual, have a question for the doctor or Denise?
I do.
Who's that?
This is Kathy Johnson.
Hi, Kathy.
Hey. I have two questions, but I can ask the first one that's more general and let everybody else ask their questions until I get, and then I can do the second one later. That's however you guys want to do it. It seems like that if we have any mental health issues at all, that those have really been exacerbated by isolation and COVID fatigue. And I wondered if there were any plans countywide for sliding scale mental health care programs to address those needs.
Thank you, Kathy. I think that's really important aspect to bring up, because it certainly is an unintended consequences of living through a pandemic. We have seen substance use disorder, behavioral health issues exacerbated, and we have worked with our behavioral health, both with prioritizing vaccination options for mental disabilities, as well as, I would say, as COVID relief dollars flow into a variety of different agencies and aspects, I believe there will be a focus on the primary and secondary trauma associated with isolation, depression, and other types of losses that people have felt. Majority of my day when I talk to people about working in public health, I hear the story of the toll that it has taken. And I also most often hear appreciation for the hope of the future and that we can get back to our new normal if we just maintain some of the mitigation factors for the next couple months, and hopefully we can round the corner and get back to that new normal. In terms of resiliency and recovering, that piece will play an important part, and just being able to recognize that toll and then create services around that. I mean, people lost their jobs, the economic impact plays into that as well as, you know, I missed every holiday with my family. I usually took the on-call for my staff to enjoy the holiday, but there's every community and individual certainly has been impacted by this. So I will alert our public health and work with our behavioral health partners to make sure that's part of our recovery and resilient planning.
Thank you, Denise. Anyone else out on the virtual or on the phone line?
John, just another note, if you're on a phone, you may have to hit *6 to unmute yourself if you're having problems with that.
Hey there, this is Missy France. Can you guys hear me?
Hi, Missy, yes.
Okay. Yeah, I could ask a million questions as those on this call. I'm sure everyone's got a million questions that they could ask. And I think we want to kind of take it easy on you guys because we could run you guys through the ringer. And I honestly think that our commissioners as well are kind of on board with a lot of our thinking. But, you know, one question that I keep hearing the term, the new get back to, well, you can't get back to a new normal. You can't get back to something that's new. So we're kind of, I'm not sure what the term you would use there, but all right, so are we going to go back to the old normal or are we going to move on to a new normal? That I think is a seed that's getting planted in the minds of humanity. And there's something behind that. So if you could explain to me what you guys know of as the new normal. And from what I'm gathering here, the new normal is going to be wearing a muzzle regardless, because the vaccine does not stop this so-called virus from moving around. And yeah, I just would like to hear what you guys have to say about the new normal.
You know, I can just give you my thoughts, Missy. I think, you know, we've all been affected by this, and we all know people that have been really impacted by this pandemic in one way or another. And I think, you know, in that sense, in that trauma that we've all been through collectively, it is going to take a while for us as people, as individuals, and as communities to live with COVID. And that's where we're trying to get to. I don't think this virus is going to go away, but we all want, again, to get to that point where transmission is low enough and protection is high enough that, yes, some people will get it the same way some people get other respiratory infections every year, but because enough of us, you know, have, immunity from past infection and from vaccination that, you know, we're not having, you know, surges, we're not filling up our hospital beds. And we get to that point, that kind of steady state where we're comfortable. And I think, you know, that's just going to take time. I think we're all, and everyone's at a different place right now as far as, you know, even if there were no rules or laws, you know, or anything, and you could go out and do whatever you wanted. I know a lot of people who aren't going to go into a crowded bar. They're not going to go into a crowded restaurant. They don't want to be around a lot of people. They're just not there yet. They don't feel safe. And I think all of us, and it's going to take different people different times because of you know, maybe their underlying medical conditions or their mental health, or just, we all have different levels of acceptability of risk, right? Some people jump out of planes and skydive. Other people, you know, are afraid to even get on a plane. So As we all learn to live with that and get more comfortable, it's just going to take time, I think, for us to get back to that where we just are comfortable being, you know, that. And I think to me, that's what that new normal means. It's going to take a while to get back to that comfort level that we were at. And I think we will get there. It's just going to take some time.
Thank you, Doctor.
One comment, John.
Wait, Beth,
Question.
hang on, we're still out on the audience. Anybody else out in the virtual or phone system? Question for...
Commissioner Wallace, this is Leonard Page.
Hi, Leonard.
Hi. I want to thank the Board of Commissioners again for conducting this town hall and our two presenters. I would hope people who have been on this meeting like hearing from local health experts and can trust their judgment. But I had two questions related to just Cheboygan County. Dr. Meyerson, I heard you say that there have been 16,000 doses of the vaccine. I wonder if you can give us figures for seniors in Cheboygan County. I'm saying that because the Sand Road Center is considering reopening for congregate meals. And of course, they are all high-risk people at congregate meals. And can you tell us anything about the percentages of over 65 people of age in Cheboygan County that have been vaccinated?
You know, and that's a good point and a great question. I do not have that data in front of me. I'm not sure if Denise or Devin would have that readily available. I think we, you know, we've made really good inroads especially with our seniors. That's a priority to us to make sure that any senior who has not been vaccinated and wants a vaccine, that they can readily get one, whether it's through us or our partners, the health centers, the providers, the pharmacists. But I don't have that exact data on the percentages of where we are in that group. Do you, Denise?
Oh, I just have at this time the 32% coverage for Cheboygan County, and that several weeks we were focused on the senior citizen population over 65 and older, and then most recently ages with all ages right now with underlying medical conditions. So, you know, we're going to continue to offer vaccine. I think that any of these establishments can call and talk to the health department about risk associated with different activities, and that those agencies, if it's a long-term care, Laura is going to provide guidance for and probably oversight for activities. And other types of facilities, there's a number that specialize in working with our residents, and we do have a high, you know, retirement community out here as well. So I know different things about routine testing of staff, and vaccine coverage would be probably some of the parameters to decision makers to look at to make that decision.
Thank you. Could I ask one more question, please?
Sure.
Denise, you made a brief reference to the recovery group, and I guess they've been called long haulers. I've seen data that suggests that anywhere from 10 to 25% of the so-called recovery group has these recurring symptoms of COVID-19 that is causing them significant disabilities. Do we have any information for District 4 or statewide on what those numbers are and what the potential cures are for these potentially permanent disabilities?
Yeah, I've heard a smaller percentage of the population with long hauler or ongoing symptoms, and Dr. Meyerson may need to weigh in. I just think they're learning a lot about how the virus may have impacted different systems of the body, and that the medical community would be working to, assess that and look at contributing factors to that as well. And I think we're all kind of looking at learning more from those individuals as to what that means for us. But I don't have any of the scientific data for long haulers that I've read recently. I don't know if Dr. Meyerson has.
I do not. I would caution, when you look at our recovered cases, that really has to, just to do with, it takes 30 days. I think the vast majority of people do recover, but the people that have persistent effects are real. I know people who, previously healthy people who, this virus it generally doesn't, but for, when you see that many people get infected, even a small percent adds up. People where it infects the heart and it can weaken heart muscles, so they have persistent fatigue and shortness of breath because they basically have mild heart dysfunction or worse. And I know, people my age who had no heart problems who, are still, 6 months out, can't do the things they used to do as far as activity levels and exercise, because of fatigue and things that are related to either, lung problems or heart problems or other things that cause persistent symptoms. And, that's kind of scary. It's unfortunate. It's, I think most people recover again, but for those that don't, it really is an issue.
Thank you, Leonard. Doctor? Anyone else out there?
And
This is Kathy again.
Sorry, I also, for Lori, I looked at the state website just now, and Cheboygan County, they're saying for seniors 75 and older, about 60% are vaccinated, which is good news. That obviously we still have more people out there, and we need to reach out to them, but 59.57% is pretty good considering we just started this 3 months ago. So if that helps answer your question.
Thank you, Doc. Anyone else out there?
Kathy Johnson again with another question.
Okay, Kathy.
Someone told, I run a 582 seat opera house in Cheboygan, and we've been dark since last March. And so just briefly, we're planning on reopening in stages. We've been watching the COVID numbers in the county since day one. I heard you say we should vaccinate staff and do staff testing. And I also agree with you that I think many people won't come in anyway for a while until they feel safe. So we want to provide a safe environment. Is there anything else I'm missing?
I think you're right on with offering vaccination opportunities to your employees, and then the MPA, like there's screening and assessment of recent travel for employees, so that's recommended. And then the incremental stages following whatever distance for that type of venue is all right on track with the potential then to reopen.
All right, thank you.
You're welcome.
Anyone else out on the virtual world or by phone?
Yes, this is Lena Thompson.
Hi, Lena.
Hello. I just wanted to ask both the doctor and Denise from the health department, what do you think is the best way to get folks to understand that masking up is really more about stopping a communicable disease? I don't know if people really understand that they can have this virus and they can have no symptoms. They could walk around not knowing they're sick. They can pull their mask down below their nose, and that's where most of the virus, a lot of the virus comes out of your nose, not your mouth. And they could be passing this on to people that they love. Like, I mean, I've heard horror stories of people that have lost whole families because like a family member didn't want to tell them that they were COVID positive. This is like kind of like HIV. I mean, you know, we did campaigns about putting condoms on to stop the spread of HIV. I kind of look at masking as sort of the same thing. But how do we get that, like, that altruistic, like, I care about my friends and my family and my community, and that's why I wear this mask? How do we get that really out there?
Well, thanks, Lena. I think you just did a great job, and that's how we do it. What you just said, you know, I think, you know, we message that, but the more, you know, the more people that can share that can really help encourage that message, and that and it shouldn't. And as one other thing that you mentioned, you did a nice job. It's not, you don't want to shame people. None of us want to get this. None of us want to give it to our loved ones, but it just happens sometimes, and you may not know it. So it's like, well, how, you know, it's not your fault. You weren't even sick, so you didn't want to give it to your loved one. How would you, you know, if I'm sick, I'll stay home, but you don't know, and that's why, you know, wearing a mask can help reduce that risk. You know, and you know, it's not about shaming people. It's about reducing the risk, that harm reduction, and you did a great job of spreading that message. So maybe that'll help. Thank you.
Anyone else out there in Netherlands?
Yes, this is Betsy Gann again, and I would like to ask the doctors, based on autoimmune issues, where they say that is, you know, between that and elderly people, pre-existing, you know, conditions, that kind of thing, which I, as I stated yesterday, have a lung condition, well, M.P.A, so I've been dealing with autoimmune for several years, but I have not been wearing a mask. I've been traveling, I've been hugging, I've been kissing, I've been, you know, socializing. I have not abided by any of these rules, you know, period. And I've been to conferences, I've been to rallies and stood amongst thousands and thousands of people with no mask. How come I have not been sick? Why? And I, plus my two kids, when this all began, they were both sick, and I took care of them, and I did not get sick. You know, I'm really struggling to understand how come all of us that are not wearing masks has never once been sick.
You know, I think I'm happy that you are healthy, and that's wonderful. And you know, not everyone, again, the most people who get this do get over it, but not everyone is quite so lucky. And you know, I know people who have, you know, who are perfectly healthy, who have gotten very sick from this, and I know people who are very frail, and, you know, a 91-year-old with a lot of problems who got COVID and got over it just fine, and that, you know, was sick for a few days, and that was it. And that's, you know, boy, I feel great, and I'm happy that she recovered. And for you, I'm happy that you have, you know, you have not gotten sick. I don't know, maybe you were already infected, maybe you just haven't been exposed yet. So, and you still could get it later on. So I think it's great that you haven't, but you know, not everyone is quite so lucky.
But I just said I took care of my children with no precautions, and I do have a lung disease. Like, I'm supposed to be high risk. And
Right.
That's my point, as well as my mom and my dad, who had stage 4 cancer. My mom's got the lung condition, and none of us are like shutting ourselves up and wearing masks or anything like that. Nobody's getting sick. If it was a true pandemic, why aren't people dropping dead in the street?
Well, I think you're very fortunate, Becky. Count your lucky stars.
Yeah,
Anyone
how
else?
many people have you infected though, unknowingly? Have you had the antibody test to find out if you have already had the COVID, and you probably could have already passed it to people? Wear a mask.
Like all of us.
Thank
We've all
you.
been exposed to it. We've
Thank
all
you.
been passing it
Not a
around just
debate.
like the flu.
This is not a debate, please. We're here to ask questions of the professionals. Anyone else out there in virtual land?
Yes, this is Missy France again. I would like to ask, so why are we not treating the flu the same way we're treating COVID? The way I kind of see it here is we're doing all this mass testing. And again, if you go to the CDC, you will see that our death rate has not changed at all. We're still at like 0.8% the year 2020 compared to past years. So the death rate has not changed. We're not experiencing a pandemic. Now, in the past, if we did the same numbers, if we did all the same type of testing for the flu, would we have come up with the same type of numbers for people that are walking around exposed to the flu and transmitting the flu and not knowing it? Just the same scenario if we had the flu. We take out COVID and we put the flu in. Everything is the same. Nothing's changed here. And so why, like, please explain what the difference is. People are still dying. In fact, if anything, probably more people have died from the flu in the past than they've really died from COVID. We don't know these COVID numbers. Can you guys agree that there has been some manipulation of the COVID counts? You guys know, you hear it just like everybody else does about how many numbers have been manipulated out there stating that, oh, they died from COVID when they died from some random normal deaths that people die from. All kinds of stuff. I mean, what are you guys thinking here? What's the difference between the flu and COVID? Really, deep down inside. Not the narrative of the pandemic.
So I can address the difference between COVID and the flu. And, they have their similarities. They're both respiratory viruses. They're spread very easily. They're very contagious. Some of the differences would be a typical flu season, the number of deaths from flu, and they do calculate that every year. And some flu seasons are mild and maybe 10 or 20,000 people die from it, and some are more severe, but on average, 30 to 50,000 people die every year from the flu. And one thing is we have a flu vaccine that we give every year, and that certainly helps prevent more deaths and hospitalizations from the flu. That, as this started, we did not have a vaccine. There are medications to treat and to even prevent severe flu. We have antivirals against flu. When this pandemic started, we didn't have any of that. And when you look at the death rates from flu, you're looking at maybe 0.1% or even less than that. So when you look at a 1% mortality rate, and I'm sure as we learn more that number will go down, but even a 0.5% or a 0.8%, as you said, is 10 times more. And that's where we have 500,000 deaths instead of 50,000 deaths. It's just an order of magnitude more deadly. And if we can get to a point where it is similar to a flu, I think that's when you'll see a reduction in all the measures that we've had to take. So that's the difference between them. When we had the pandemic from flu in 2009, the H1N1, we didn't do a lot of these things because fortunately, although that pandemic, that was a very contagious new virus that no one had immunity to and many of us got sick, fortunately, it was mild and it did not cause nearly the issues in morbidity and mortality that we've seen this year.
Thank you, Doctor. Anyone else out there? Okay,
Yeah, this is Missy France again.
Missy?
Okay. I know, this is all a joke. Thank you.
No,
Thank you guys for putting this together to pacify people. It's appreciated.
Not a joke, Missy France. It's not a joke. This is a serious question and answer time. Not a joke. Anyone else out there?
Hi, this is Susan Page.
Hi,
I
Susan.
have a question about what the doctor's or the health department recommendation might be for how schools should be run. You know, since apparently some of this recent surge was because of the school sports and school activities.
You know, the schools you know, I'm actually really proud, and Denise, you can chime in too, but we have managed to keep our schools for the most part open since September, and a lot of communities have not. And I give our schools a lot of credit, our communities a lot of credit, because I think, you know, in-person learning as we are able to is really important for our children. And I think one of our community's strengths is we've really always valued, you know, providing, you know, a quality, you know, life and quality education for our kids. So I'm really proud of the work that's been done for that. As we, you know, re-engage this year, this new year in 2021, and we have had some outbreaks, especially related to gatherings, whether it be from, you know, athletic teams or other groups of students. And that certainly has created problems, but I also, you know, realize the benefit that has for the children and the students, and that those activities are important for them. So we continue to work with our schools to try to maintain a safe environment and still provide, you know, that quality education. And it's not just about schooling, it's about the, you know, all of the activities and all of the things that schools provide for our kids. So that's a balancing act. Our schools have been really proactive in that sense, and we continue to work with them to provide that as much as we're able to, and balancing that with the impact that's having as well, because as they've re-engaged, we have had many outbreaks, unfortunately.
We've met weekly with superintendents, and I know Dr. Meyerson has been involved with school board meetings to make sure all the board members could make informed decisions. And we really try to make all our decision making to keep our littles in school. And then, of course, parents can make informed decisions for their children or their families as they see fit. And, you know, the psychosocial value of being part of a sports team, and the achievement of being part of a sports team and excelling is definitely recognized. And, you know, there's definitely tolls at all levels of our life from the pandemic. And I'm really proud of the work we've done with the schools, and I know those superintendents have been in tough positions with parents with all different perspectives as well. But I do want to applaud their leadership with the school system and the parents.
Thank you, Sue. Thank you, Denise. And Doc. Anyone else out there in the Netherlands? Okay, we have a couple more questions from inside. John Studer.
Thank you. Question about the antibodies. How long our bodies actually have them after we've already had COVID? There's a lot of question about how long we are still immune. Can you answer that?
I can try. That's a great question. They're still studying that as this is new. I think immunity for many of us, and you know, and it's not just from antibodies. So you know, your immune system has lots of different ways to protect you. And there's what's called cell-mediated immunity, as well as the antibodies. And so they're still trying to learn, you know, what antibody levels would necessarily predict how protected you are or how immune you are. I think most people who are, whether they're infected or hopefully through being vaccinated and fully immunized, that they will have protection that lasts a long time. I think, you know, whether that is 6 months or a year or 2 years, we will continue to study that, and the CDC and the clinical trials, they continue follow that and monitor for, breakthrough infection to see, if there's is there a need, or is this going to be like a flu shot where you need one every year? Does it last longer? What goes on? We will find that out with time. We just haven't been there where it's only, this virus, we weren't aware of its existence until a little more than a year ago. So we continue to study that, but I think right now, if you are fully vaccinated, you are considered immune and are unlikely to become infected, and we haven't put a time limit on that at this time.
Well, I'll give you a little knowledge I have, some from medical professionals that just were tested a year later and they still have the antibodies. Then my last question is, why is the CDC telling hospitals to do no further tests if they test positive for COVID? How come they're not checking for influenza and some other things that can show up the same?
Thank you, John.
Thank you.
Oh, I'm sorry. So the question about, testing, when people present with typical symptoms and they have a positive COVID test, that, is usually, it's really up to the provider to make that diagnosis. I know they do have, and they utilize different forms of testing. Some of the respiratory testing is where they test for several viruses all at once. And I know they continue to use that as well. And there is also continued surveillance for the flu and other viruses. So I wouldn't say they're not testing for it.
According to the CDC's website, that's what they're saying, is not to test any further.
It doesn't fit the narrative.
Thank you, Missy.
Thank you. Okay, we're closing this to questions from the audience, either by virtual or in person here.
Sorry, I didn't know we were closing. Could I ask one last question?
Okay, sorry, go ahead, come up.
Okay.
Your name?
Owen Goslin from Cheboygan.
Owen.
My question is I'm curious what will happen if we don't reach that 70% of vaccination that we're hoping to reach. We're on to a good start. I'm looking forward to my age cohort getting that opportunity to get back pretty soon. I intend to. But I also hear a lot of people who say that they're not going to get vaccinated. So I'm curious, what's the danger to the community if we only get, say, 40 or 50% of our Cheboygan County vaccinated? Thank you.
Thank you, Owen. Anyone want to answer that?
Well, I just would like to say that a decision to get vaccinated is a personal one, and informed consent decision-making is an important process with medical care. If individuals have personal questions, I think they should be consulting with their own doctor. And I know if there's general questions, we have a hotline and our website if people want to call and ask information of the staff that are working hotline numbers. And I think that we're still in the first quarter of the vaccination process with a long ways to go. I tend to be more optimistic, and I think there are some people on the fence with wanting to wait and see. And so I'm hopeful as we progress forward that people will get their questions answered. And we have talked about a buddy system appointments. We see a lot of married couples coming together and getting vaccinated together. So I am hopeful that the information will inspire people to get vaccinated. But, there is a variety of reasons why people may be hesitant. And the timing, I think, is key as well. From the pipeline of immunizations, we are likely to get more and more vaccine available to the state of Michigan and to our area. And so that's been part of the problem in January and February with some limitations there. The more vaccine we get, I'm hoping our neighbors feel like they have some options, and that we'll get to that 70% or greater. Thank you.
Thank you, Denise.
Commissioner Wallace, can I ask for just one more? This is Louis Balance again.
Real quick, Louis.
Okay. Coming from a food service background, knowing that the restaurant industry is usually one of the cleanest industries out there, with you having everything aerosolized, with quaternary ammonia and bleach, being used in all these restaurants, I would say that the aerosolized sanitary effects of those chemicals should outweigh the virus aspect. So I think that wouldn't it be wise, knowing you can ask your environmental sanitarian Kyle there, that the restaurant industry is the most cleanest, one of the most cleanest industries out there. Why is the restaurant industry being penalized so badly on this? It's unfair to the restaurant industry that we, in the industry would have, these heavy restrictions when the restaurants are normally pretty sanitary and clean. Obviously, if they would not be clean, they would not be open. So, just a question on that.
Anyone have any knowledge on that?
I can comment that, the restaurants do a wonderful job, and most of our restaurants, really take the importance of food safety and sanitation, and they do a great job. And unfortunately, the virus is transmitted, when it's transmitted from person to person through those droplets that come out when you're in a crowded area, especially when you're eating and drinking and, talking and doing all that. I used to love to go out to eat and enjoy a nice meal with friends and family, and I want to get back to that. But that's how this virus transmits, and you can sanitize your surfaces and everything, every hour, but you're still going to have transmission there. And we have seen, transmission. I know last summer, we had a lot of restaurant workers who were out, and because they're basically out there in the direct line of fire, the servers, and that's why masking was important for them to help protect them. And I hope we can get our restaurant employees, they are out there, they're front line, and I want to see them all get vaccinated, because I know we had restaurants that had to close because they wouldn't have staff, because their staff were all out sick or quarantined from COVID. And if we can protect them, then the restaurants will be able to stay open. They'll have the staffing. I know it's hard enough to keep your places staffed in the busy summer months. So as we look, we're getting there right now. It's springtime coming. I want to hopefully, be able to provide that so that your restaurants can stay open and provide that safe dining environment.
Thank you, Doctor. Thank you, Louis.
Thank you.
We have one more inside here.
Joe Klein.
Hey, Joe.
I just received the NIH paperwork here. I just made a couple of comments, and my bottom hope for the health department is we're fighting a Goliath, and I'm hoping, like David, with that small stone, he defeated Goliath, and that's how I'm trying to view this vaccine. So for that, kudos to the health department. The only problem I have is that with the vaccines is that there's not been enough research. And you're saying or trying to sell that in 7 to 10 months, you've established a vaccine on something you haven't seen before, like the flu, yet vaccines normally take 7 to 20 years. Are we supposed to accept these parameters? Don't get me wrong, I'm trying to boost you people up and trying to follow your mandates, not the mask, because I do have health issues, but what I'd really like to know is, has any of the research that you've done, has the research been given to like 100,000 people? And have they been tested by having them being exposed between 30 and 60 days to other people who have definitely have had or have COVID? So I guess my question is, did they succumb to the symptoms again of COVID? If that's the case, that would be research that the public needs to hear, because then we'd finally have a chance to believe you and support all your efforts with the COVID vaccine. Thank you.
Thank you, Joe.
You know, the fact that we have this vaccine, it is life-saving, and it is saving lives, and it is a marvel, and it is amazing, and we should be. I am very thankful that the technology and the wherewithal and that you know, Operation Warp Speed, that we could get this. But you know, the research into like mRNA vaccines is over a decade old, so it's not like it was brand new technology. They've been researching this for a long time. The fact is you know, they were able to sequence the entire genome and publish that so that anyone in the world who wanted to study it could have access to it. You know, I think it was January of last year. So really amazing speed and it's incredible when you have a world and you put all of the resources of, you know, this great country and all of the resources we have, and the financial resources and all of the resources of our academic scientists to work, you know, in focus to produce a vaccine quickly. It's really amazing. And remember, it wasn't just, you know, we have 3 vaccines out now. There was 12, 20 or more companies working on this, and so they were all working on it. How did we get to this point? Was that, you know, our country and many other countries said, we will pay for your research, we will pay for your vaccine development. So it took away the risk. It does. It usually takes 10 or more years to develop a vaccine product, because the company is going to be very slow in progressing through the different trials to see that the vaccine is viable, because they're companies and they can't spend billions of dollars on something that may not work. But our country and other nations said, we will take that financial risk, we will bankroll this. And so that at the same time they were researching things, they were producing vaccines so that if it was, as soon as it was determined to be safe and effective, they could release a stockpile of vaccine and we could immediately start protecting people. That happened because of, you know, the cooperation and the collaboration between the government and the companies and our research scientists. But it did go through. The one thing that wasn't rushed was the phase 3 trials, and the phase 3 trials is where they gave, 40,000 people were enrolled in the Pfizer and 30,000 people in the Moderna, and half got the vaccine, half did not get the vaccine, but they got a placebo. No one knew which one they got. It was double blinded, and then they simply followed those people to see who got sick with and were tested positive for COVID. And one of the other things that allowed us to get this vaccine, unfortunately, is we had a lot of viral transmission that was going on in the summer and fall. So it didn't take too long for people to come down with COVID after receiving either the vaccine or the placebo. And that's where they were able to, over that time frame, to look and say that compared to the group that got the placebo, that got just the injection of salt water, of saline, they were 95% less likely to get COVID if they had actually received the vaccine. So it was given to thousands and thousands of people. They also followed them to see if they had any adverse effects. That's where they came out with the percentages of people who had sore arms or fever or fatigue following vaccine or any other adverse effects. And now we've given 40, 50 million doses of this vaccine to people across the country. So it is truly a medical marvel, and I am very appreciative of it. But the important things to establish the safety and efficacy were not shortened in any way. So I'm very confident.
Thank you. We have one more question in the back.
Yes, if I can, please. Thank you. my question is that,
You are?
William Brunel, Benton Township, I'm sorry, sir. There's been saying, wear a mask, don't wear a mask, wear 2 masks, don't wear a mask, and they say that wearing a mask, you inhale your own carbon monoxide and whatever you're exhaling, I don't want to say diseases, but CO2 carbon, but whatever you're exhaling, they say it's not good for you to do that, to wear a mask, to inhale your own carbon dioxide, your own diseases. So what do you say about that? And please don't answer me with, I have no data. Thank you.
Thank you, William. Doctor and Denise, we thank you for appearing here and giving all this knowledge to us and answering our questions. We appreciate your time, and we can let you go now. And we want to hear from the sheriff as to what's going on with our vaccination program here in the
I
county.
don't know that Mr. Brunel's question was answered. I don't know if you gave him the opportunity to answer. No, it wasn't answered. The doctor.
Oh, doctor, I'm sorry, I'm jumping ahead again.
Yeah. I can just answer that you can safely wear a mask. People do for hours and hours in hospital settings, in surgeries that go on 10 or 12 hours. You have doctors and nurses in a room wearing a mask. You cannot get carbon dioxide overload from wearing them. They safely do it all the time. They've been doing it in every hospital, in every operation room, and all across the world. I wore a mask for over 12 hours yesterday, and again, I'm not saying I enjoy it, but I don't think there's any risk to my health or anyone else's. Thank you.
Yeah, I think there are different masks that they wear in the surgery room than what you wear outside of it.
Okay, thank you.
Mr. Chairman, could I ask one question?
Thank you. Okay, we have one more question from a commissioner, doctor.
Yeah, a constituent asked me if I could find out more or the opinion of the accuracy of these tests, and brought up, and I didn't know the full details, but apparently Elon Musk took 4 tests at the same time, and 2 tests came back positive and 2 tests came back negative. So could you perhaps maybe tell the people what is the accuracy rate of a test today? And also one of the questions was it true or not true that in the early test there was actually, from the CDC, there was actually COVID virus on the actual test that originally that the government had rolled out?
Well, I don't know anything about what Elon Musk did or didn't do, so I can't comment on that. Our tests, I think what maybe you were alluding to is at the very get-go when the CDC was developing the test for people to utilize to test, there were some issues in that accuracy, and that delayed the rollout of testing. And if you can remember back to that time, you had other countries that were testing thousands of people a day with tests, and you still couldn't get a test here. And we had a lot of issues, especially here in northern Michigan, where you just couldn't get people testing, and it was very limited. And that had to do with some, some issues that happened, at the CDC and at the federal level, that was, disappointing for all of us. But right now we have a lot of tests that are FDA approved. Our PCR tests and our rapid tests are both very accurate. The accuracy is, no test is 100%. You always have to use, you have to know what's going on. I mean, any doctor would tell you that, the tests confirm diagnoses, but it's not everything. You have to look at the patient. You have to look at the whole patient, right? So that test accuracy also depends on whether that person has symptoms or not. What else is going on, what the disease rates are in your community. But PCR tests to look for the detection of the virus really are very accurate. They're not 100%. They can miss. And of course, in real life, when you obtain a specimen, the test is only as good as the specimen that you obtain. And when you have to put a swab deep into someone's nose, and you do it you know, when you look in the country and you're doing millions of tests a day, are some of them going to be poor specimens, or maybe they weren't stored properly? Well, of course, there's going to be times where you have things like that come up where you might have false negatives, where it doesn't show when the virus is there. And tests always have some false positives, although really those are fortunately very rare in the testing that we have.
So you don't have a standard number, what the percentage of, when the supplier brings you a test, they don't give you a benchmark of the accuracy of those tests?
Oh, no, they do. And they give sensitivity and specificity. Those are all published in the inserts. They have to do that. They're in there, and they're all a little different. The PCR tests are on the range of 98, 99% sensitive and specific. The rapid tests, those rapid antigen tests, are a little bit less reliable. We all know that. They're about 85% sensitive, so they can miss more infections than PCR, and they're also not quite as specific as PCR. So they can, in someone who doesn't have symptoms, give you some false positives, and that's where you would need to do confirmatory testing. And there's different brands out there, and they all have slight different numbers, so that's why I didn't want to throw that out, whether it's 84 or 85 or 87 or 98 or 99. Just depends on the different brands and the studies that they did. But what you really care as a person is how predictive are they, and that just depends on the factors going on in the environment, and if you have symptoms and what the disease rates are. And that's just the statistic.
So that 15, so on that 85% accuracy, is that false positive accuracy or false negative?
No, the 85% is with those rapid tests. That has to do with some of those rapid tests, their published sensitivity, which would be false negatives, meaning they miss the infection. You have it and they come out negative. And I can tell you, you know, I have different places where we utilize both of those. And I've done confirmatory tests where we've taken 10 rapid tests and then at the same time swabbed them and done PCR tests. And we've had very good correlation. In those 10, it was 100%. I have had people, though, who at their very first day of symptoms, I've had a nurse do a rapid test and they've been negative, but they had really typical symptoms. And I said, well, have them stay home. Let's test them tomorrow. And they come back the next day and they test positive. And that just tells you that, you know, initially they just didn't have enough virus to make that rapid test turn positive. And I know that's a limitation of the rapid test. It's not as sensitive as the PCR, but it's there and it's available and I can get the result right away. So as long as I understand their limitations, they've been really useful.
Thank you.
Thank you, Doctor. Well, again, thank you so much for being with us in this public information session. We can let you leave our session if you'd like to now, and we'd like to hear from our sheriff as to where we're at on our process for vaccination. Thank you, Doctor.
Hey, can I just, this is Missy France. Since you're bringing up the sheriff, I would like to ask too, you know, how we all can find out, because I think this whole call was really about how COVID was affecting our community more so. And, you know, I know we've got the CDC in different places we can go, and where is it that we can go to find out what's happening real time in our community as far as COVID's concerned? And what really got me thinking about that is I had just heard maybe 20 minutes, half hour ago now during this call that that someone heard over a scanner that the ambulance was dispatched to the KFC, to the vaccine deal there. Someone had a reaction to the vaccine. So of course that's kind of timely that would happen right now and we'd be hearing about it. So yeah, like how can we really know what's happening in this community real time, and how do we find out, okay, this person that, you know, had this reaction, like, okay, what's going on? Because now we're all going to be curious, like, okay, what's going on? Like, this is interesting. So yeah, I guess that's my question, you know, since this whole call really was about how it's impacting our community.
Thank you, Missy. Who wants to answer that?
So I'm not a doctor, but I stayed at a Holiday Inn once, right?
That's good, that makes it work.
Yeah. So we have had several vaccination clinics, and we have had several incidents that the ambulances had to have been called or emergency medical personnel on scene at the clinics have had to assist people. And it's everything from reaction to slip and fall. So I don't know the specifics of today, nor can I share any kind of HIPAA information, but I do know that we have had that happen in the past. There has been no serious reactions where anyone has died. The ones that we have had that have been reactions have been very minor. So hopefully that answers your question.
Okay, you want to talk any more, Dale, about?
I'd like to double tap on what the chairman said about our clinics out there. I've been out there and personally and watched them. The logistics of it, I give all the credit to Sergeant Holt and this board for bringing the Office of Emergency Management back to Cheboygan County. That way we have 100%, you eliminate the bureaucratic mess that we had before. And so it has been very efficient. I also want to credit District 4 Health and all of the volunteers. I think Denise said it, takes a village, and I agree with that. It takes all of our volunteers, our health care professionals, our law enforcement, everyone working together in a cooperative way to pull this off. And for those individuals that have made that personal decision that they want a vaccine, we have been able to provide that very timely, very efficient, very safe manner. And so I also thank KFC for offering that facility. We did several site visits, and I made the decision that we were going to go with the KFC because of the ease of parking, because of the ease of getting into and out of that facility for the individuals that would be there. So it has been going very efficient. It certainly is not mandated, but for those individuals that have made the personal decision they want the vaccine, we have been doing that, been doing it very well, and I commend all of those individuals that are involved in that, and Sergeant Holt for being the logistical mastermind behind that.
And I was just wondering if this would be a good time for the sheriff to also kind of, a lot of people don't realize about how that Office of Emergency Management just happened before this transition. And maybe back in the early years, a year ago, as we were just sharing, you know, this is an anniversary day for a lot of things for people here. You know, I was laying in the hospital 9 weeks ago this week too, you know, and so I've had a lot going on, but in that time, we were getting so many updates from Patrick, and I was just proud of it.
Yeah, as I've said to this board and to the public, sometimes it's better to be lucky than good, right? And we had an ongoing issue with the Tri-County Office of Emergency Management. I, as the county sheriff, did not feel that we were getting what we were paying for, what the taxpayers of this community were paying for. So I put together a proposal for this board to bring that back to the county, to break the interlocal agreement with the Tri-County and have 100% supervision of that and control. And I offered to do that through my office, as it is done. I believe we are now the 7th county in the state to have their own Office of Emergency Management directly under control of the sheriff. Okay. And so in doing so, we saved, now we know, about half the cost of what we were paying for to be within the interlocal agreement, and we are getting 100% effective use of that office instead of the 33 and 30%. Okay, and it just happened to be that right after, I mean, within 2 weeks of me making the recommendation to this board, COVID hit. I remember the date very well because my wife and I were on our way to Florida to get on a ship and go on a cruise. In Ohio, I told her I have to go back, we stopped in Ohio for the night, and I told her I have to go back, COVID hit, and I have to do my job. And she was not real happy with me, and still is not forgiving me. But that's what people elected me to do. We came back here to the Office of Emergency Management. We were able to put into 100% full swing. It was so effective with Sergeant Holt's direction that Cheboygan County was actually picked to be a central point for distribution of PPE for several counties in northern Michigan. We used the facility right here, and we ran it in a paramilitary organization fashion. And Sergeant Holt, being a vet himself, was very receptive to that, and it became very, very effective. So, like I said, sometimes the timing is better to be lucky than good.
Good move, it's a God thing.
Yeah, exactly. Does that answer your question?
Yeah, well, I knew it, I just wanted other people to know, because there's a lot of people didn't realize how much PPE that Cheboygan County, they're talking about shortages. And again, back to the ask, we were prepared. We knew how to make the ask. Other counties didn't know. They wanted to blame certain agencies for not doing this. They were waiting for people to help them, just like what I see happen a lot of the country, where communities are looking for help instead of stepping up and leading.
Yeah, don't, firm believer, you lead, you follow, or you get the hell out of the way, right? And I believe in leading. I will give during my annual report to this board the actual numbers, but the amount of PPE that came through this county was in the hundreds of thousands of pieces. And so I include everything from gowns to gloves and hand sanitizer, the plethora of everything. So, and not only were we prepared by doing that, we are also able to provide the hospitals and the long-term care facilities and the adult foster care facilities the equipment that they need.
That was unheard of at that time.
It was unheard.
Amazing.
So subject to any questions, Mr. Chair.
Any questions for the sheriff? Excuse me, just a minute, from the board. Any questions for the sheriff?
No, but I have a comment. Oh, I can't do that question. Do it later.
Go ahead.
I just want to say it was wonderful. Thank you so much for everything you and the Dr. Cole, at the KC Hall. I went for my shot, and it was a wonderful experience. I was a little nervous, I have to say, at first, but you walked through, and everybody had a smile on their face as they greeted you and assured me that everything was going to be okay. I went and sat in my car, and they said, if you have a problem, honk the horn. I didn't have a problem. I left, and thank you. It was great.
You're welcome, and I'm glad we could provide that. Once again, I give all the credit to Sergeant Holt, District 4 Health, all of the volunteers that did it. We put it in place, and they made it happen.
Okay, one other question, please.
Debbie Pond. Thank you for everything you do in the community. I appreciate it, and thanks for the smooth running of the KSC vaccinations. I hear it's wonderful. My question is about the jail. I'm sure that things have changed a lot with COVID as far as practices, and I'm wondering if you could talk a little bit about how things are working with the inmates at the jail.
Okay, certainly. I know it's a little off subject, but Mr. Chair, if you're okay with it.
Go ahead.
So when the pandemic hit, right after I came back from my shortened vacation, I implemented what's called an XYZ plan for the entire department to include the jail. And the XYZ plan is a military terminology, but I put 33% of my staff on work from home status, 33% of my staff was in the reserve, and the other 33% were working, okay? As far as the jail, it was the same thing, my entire staff. I also worked with the courts and the prosecutor, and I give them the credit for this. They worked very well with me. And we either released individuals that had met at least a minimum of 80% of their jail sentence, were low risk and were not considered to be a risk to the public. We released them from the jail so that we could open up the jail and we could have, if for those individuals that did need to stay or those individuals that were coming to jail because of very serious crimes, we had quarantine areas. And so that's how we did it. We lowered the inmate population. We worked on an XYZ plan. We closed the jail to any external. We closed the external being, say, church services, AA and stuff. We didn't allow anyone in the jail because we didn't want the disease to come into the jail, because if it did, we were in trouble, okay, with as fast as it spreads. We also took and initiated throughout that we would not be accepting any low priority warrants. So if there were warrants for individuals, felony warrants that were very serious, we would accept them, but we would be able to put them into a quarantine. And so we did it so that we could control everything coming and going from the jail, and we were very limited as to what we would accept. We also did, we transitioned to 100% visitation via Zoom. I say Zoom, it's some kind of software that allows the inmates to have visits via the internet versus in person. So that, once again, kept all of the disease out of the jail. And I can say that it worked for us. We had 0 cases in the jail because of that. And so now we are back. My staff is fully vaccinated, as am I. And the 2-week lapse between the last dose and the full effectiveness of the vaccine in accordance with CDC, we have passed that, and now we have opened up the jail back to pretty much routine business. We are still working with the courts and the prosecutor to only accept those that are, we believe, high risk inmates. And so our jail currently has 104 bed capacity, and this morning we were at 61, and that is by design. So well, we're getting there, but we're not there yet. Does that answer your question?
Yeah, so are you still doing the Zoom meetings for the families, or, I mean, are people allowed back into the jail for visits, or is everything still basically locked down?
The people are allowed into the facility, but all visitation is via Zoom.
Okay, great.
And the inmates actually like that, and so do family members.
Right.
Because say you have an inmate that home of record is Detroit.
Right, exactly.
That they can do visitation via Zoom. We, once again, sometimes better to be lucky than good. We had just signed a contract with our telephone provider that we were going to that 100% visitation via electronic anyways.
Okay, great. Thank you. Yeah, that's great.
Okay.
Thank you, Deb.
Which vaccines are you administering out of the KFC? The AstraZeneca, the Moderna, the Pfizer?
We don't administer, we just do the logistics.
Okay, gotcha.
So that would be a question for District 4 Health.
Oh, I see. So they just bring in whatever they
I don't want to comment.
Okay, no problem.
I don't know that.
Thank you.
I had Moderna at
Did you?
KFC.
Okay.
And I had Pfizer at KFC.
Oh, okay.
So I think it's whatever the health department
Right,
has
gotcha.
Supplied.
been supplied at the time.
And I had Moderna. Okay.
Okay, thank you, Sheriff. What's the board's, we can finish this up pretty quick, I think. There's no old business, no new business. Citizens' comments, I think we've heard enough of that. I think we can put that aside for today. We'll hear it more in next meeting. Jeff wanted to cover something under board member comments. Supplemental administrator's report.
Provided to the board, just wanted to make the board aware, at the end of the month here, the state's order allowing remote meetings expires. Talking to Matt yesterday, there doesn't seem to be any movement. There is a bill on the, in Senate subcommittee where the Senate's discussing that, but it doesn't look likely to be approved by the end of the month. So I wanted to make the board aware that after the first, the only way to have a remote meeting in Cheboygan County, the board would have to declare a state of emergency to do that. So I wanted to make sure the board's aware of that. Talking with legal counsel, the county has that state of emergency, so other units may or may not be aware that that expires at the end of the month. So
it could be a problem for the townships.
Wanted to make sure the board was aware of that and take any directions from the board.
Actually, that was a question I meant to ask the doctor was, how is it that the health department gets to meet a person? Just they get to override the rule?
I don't have an answer for that. I've never posed that question.
Your statement is fact. Having attended your meeting last week in Alpena, you're absolutely correct.
Again, if we not do that, can they not,
It comes the same,
again, what's good for the goose is always good for the gander.
At the end of the month, under the orders right now, you can have up to 25 persons in a room. So municipal units can do that after the first. Without the state of emergency, what they won't be able to do is have a remote meeting. So our hybrid meetings that we have today, without that order or a change from the legislature, that would be permitted under the law.
So do we need to take action today?
It's up to the board's discretion, what.
Restate that, and I guess I misunderstood that.
Yeah.
You're saying to do that, if we don't state the emergency, we can continue to meet and everyone else continue to meet in person up to 25 people.
That's what the state order is,
Okay.
what I understand from the health department.
And for anybody else that wants.
I thought you meant that was the only way we could go forward with that, but you're saying just to continue to do the telephonic.
It's for
Yeah,
electronic.
that's to allow that.
Under the open meetings.
Both parts of it.
But, so we'll have our meetings, but we could still telephonically allow public to listen.
Some townships may not be aware of it.
Well, no, my point is we don't need a state of emergency, we're meeting in person now.
No, correct.
What we would do is, check with legal counsel, it should be legal we could live stream our meetings. They just would not be interactive. So it'd be
Right.
similar in the past if somebody watched a live cable feed or something like
Right.
that, or listened in some audio in the past, that was not unusual.
Thank you.
So I just wanted to make sure the board was aware that at this point, it's not moving in the legislature. There may be units aware or not aware of that before the end of the month.
Again, my question is, do we need to take any action?
But that's what the board would need to decide. If you want to take action to declare an emergency to allow units to meet remotely, then that will be in force till the 30th. The board chair can issue a 7-day order. After 7 days, it has to be approved by the board of commissioners.
So does that get us to our first meeting in April then?
Our first meeting in April is the 14th.
So that wouldn't get us there, so I think we need to take action now.
You can do that or set a special meeting, whichever way. We don't have a resolution here today, but we can prepare that if the board would like to take action. You would have another reconvene meeting, and you could vote on that at the time. So we do have time to do that prior to expiration or prior to the 7-day order.
The only thing I would say, it was not on the agenda. We added it to the agenda, so for board openness, I think we need to have an extra meeting and to discuss only that and act on it. True.
Yes, we do have time to do that before expiration.
Okay, is that the consensus then? All right. Okay, so we can reschedule it. It'd be just for that one purpose. Okay, board member comments. I have nothing. Steve?
I'd just like to join Commissioner Matowski in congratulating Sheriff Claremont, and particularly Patrick Holt, who I like to refer to as the young man that experienced baptism by fire within a matter of days. He's into it up to his neck with the sheriff's leadership and that young man's talent. He put us in a glorious position to be after having made a very difficult decision. But the economics and common sense demanded that we do that. I'd like to reiterate Roberta's comments. Congratulations to you, sir.
Thank you. Thanks, Steve. Bryan?
I have nothing,
Roberta?
just lots of good information today. Dr. Meyerson and.
I think this was an interesting and informative session, so. I'll bet you in the next few years, meetings are gonna be a whole different program. Looks like it. Design is gonna be different. A lot of different bodies will meet differently. With the technology they got nowadays, it's amazing what's going on. So how about a motion to adjourn?
So moved.
Thank you, Seth. Support?
I'll second it.
Thank you, Roberta. All in favor, say aye.
Aye.
And the clerk will record the same. Thank you, Ron. Thank you, everybody.